Tonight, the U.S. coronavirus death toll has topped 522,000 people, with more than 28.8 million confirmed cases. And while the White House is touting an increase in vaccine distribution, it's been scrambling to contain fallout from remarks by Detroit's Democratic mayor about the newest vaccine approved for emergency use. CNN national correspondent Nick Watt explains.
The city of Detroit just declined a shipment of Johnson & Johnson's single-shot vaccine.
Moderna and Pfizer are the best. And I am going to do everything I can to make sure the residents of the city of Detroit get the best.
We've been in constant dialogue with Mayor Duggan, who said, in fact, that was not what he said.
Well, it is what he said. Maybe he misspoke. Either way, it's wrong. All three vaccines are
extraordinarily effective in preventing severe disease, and we don't compare one to the other. The only way that you can effectively do that is by having head-to-head comparisons in a clinical trial, which was not done.
1, 2, 3.
More than 10% of American adults are now fully vaccinated, but still no CDC guidance on how they should behave.
These are complex issues, and the science is rapidly evolving. We are making sure and taking the time to get this right, and we will be releasing this guidance soon.
Meantime, vaccine optimism is fueling the rollback of restrictions. Today, Michigan upped indoor dining capacity. No more mask mandate in Mississippi.
I know the idea of relaxing mask wearing and getting back to everyday activities is appealing, but we're not there yet. And we have seen this movie before.
You're welcome.
Today, the governor of Texas doubling down on his controversial decision to end the mask mandate and open businesses.
We are in a situation where it is safe to open up 100%, and every Texan here and every Texan across the state, they have learned for the past year the safe strategies to use.
Also today, more data published showing mask mandates do reduce COVID-19 case counts and deaths. And when restaurants reopen in person, cases and deaths do go up.
Wear a mask now so we can get to a place where you don't have to.
Case counts were heading there, but plateaued about 10 days ago. Could be fatigue, complacency, and/or those more contagious variants kicking in. So, when do we reach the Holy Grail, herd immunity in this country? Well, according to some new CNN analysis, if the vaccine rollout continues as it is, throw in the Johnson & Johnson, by the end of July, 70% of the American population could be vaccinated. Throw in those people who've already been infected, we could be talking herd immunity sometime in June, but models, projections, and hopes don't always pan out. Wolf.
That's an important point. Thanks very much, Nick Watt reporting. Let's get some more on all of this. Our CNN medical analyst, Dr. Lena Wen, is joining us. She's an emergency room physician, former Baltimore City Health Commissioner. Dr. Wen, thanks as usual for joining us. As you know, states are now dropping, several of them, their mask mandates. A new CDC study, though, finds that masks are in fact linked to decreases in coronavirus cases and deaths. Tell our viewers why you see masks as tools that give people more freedom, not less.
Well, Wolf, let's think about what it is that people really want. What we want is a return to normality, as in we want to be able to see our family, we want to go to school and to church in person, to have our businesses come back. We now know beyond a shadow of a doubt, because there have been so many studies showing this, that masks allow us to do that. Masks also help to give cover for business owners, for school administrators who want to protect their customers, their workers, the students. And having these types of mask mandates really allow the individuals to be protected while allowing our economy to come back.
The CDC still hasn't released what we're expecting in the next few days, formal guidance for the more than 27 million and counting Americans who are fully vaccinated already. In your new piece that you've written in the Washington Post, you say public health officials are choosing caution over celebration. So why is that problematic?
Well, it's problematic, first of all, because with every day that the CDC lets go by without their guidance, they are making themselves less relevant in the decision making. Individuals, there are tens of millions of people who are now fully vaccinated. These individuals are already making decisions about what they're going to do. And then you talked about these governors lifting their restrictions. Imagine if the CDC came in and said, fully vaccinated people can do the following. But if you're not vaccinated, you cannot do that. For example, if you're vaccinated, you should travel and you don't need to quarantine. You don't need to be tested. But if you are not vaccinated, don't travel. I mean, this is their opportunity to insert themselves into that kind of policy making and decision making, and they're letting that opportunity, I think, go to waste with every day that they're waiting. I also think that we in the public health community need to be a lot more upfront about what are the freedoms that people can have once they're vaccinated. That gives hope, that gives excitement. And I also think that vaccine hesitancy is ultimately what's going to prevent us from reaching herd immunity. So the more that we can talk about the life-changing and life-saving impact of the vaccines, the better that's going to be.
The White House says, and you heard this today, that a misunderstanding led the Detroit mayor to appear to turn down a shipment of the Johnson & Johnson vaccine. You're part of the Johnson & Johnson vaccine trial. I know that. How confident are you in that shot?
Well, as a scientist, I've seen the data, and I'm very confident that all three of these vaccines, Pfizer, Moderna, Johnson & Johnson, they are all safe. They are all highly effective, especially at the endpoint that we really care about, which is they're all essentially 100% at preventing hospitalization and death. That's what we should really be talking about. And I just don't understand any policymaker or individual who's turning down a vaccine, because that's the equivalent of turning down a life jacket when you're drowning. Take that life jacket now. Even if you don't like the color of the life jacket, take it, because you can always get another life jacket when another comes along. But take that. It protects you, it protects others around you, and helps us to get to the end of this pandemic a lot sooner.
Yeah, these vaccines are going to save lives, thousands and thousands of lives. Dr. Wen, thanks as usual for joining us. We're following the deepening crisis facing New York's Democratic Governor Andrew Cuomo. Not only are there new reports questioning his handling of the coronavirus crisis, we're also hearing more from a woman who accuses the governor of sexual harassment. CNN national correspondent Jason Carroll has the latest developments.
He is a textbook abuser.
One of the women who alleges New York Governor Andrew Cuomo sexually harassed her is speaking out.
He was very sweet to me for a year, in the hopes that maybe one day, when he came on to me, I would think we were friends, or that it was appropriate, or that it was okay.
Charlotte Bennett is Cuomo's former executive assistant. The 25-year-old detailed private conversations she says she had with the governor June 5th in his office.
He wanted a girlfriend. When he said he was lonely, I mentioned that his daughters had been around, and he also rejected that and said, yeah, I love my daughters, but I want a girlfriend.
Bennett says she felt the governor was trying to groom her through his line of questioning, and says she was called back into Cuomo's office the next day.
I was terrified. I was shaking. I thought any moment something can happen, and I have no power here.
And what happens when you're with the governor?
He asked me a few questions about how to use his iPhone, and then sends me back to wait. And then finally he calls me in and he asks if I found him a girlfriend yet.
He asked you again?
Yes. And I say, not yet. I said I was working on it.
When asked to comment, a spokesperson for the governor referred CNN to his Wednesday press conference.
I'm sorry. I'm sorry for whatever pain I caused anyone. I never intended it. And I will be the better for this experience.
All this as the Wall Street Journal and the New York Times both publishing reports alleging the governor's aides changed a state health department report in June of 2020 to hide higher death toll among nursing home residents. The initial report, not made public at the time, listed deaths at long-term care facilities in the state at nearly 10,000, a stark contrast to what the Cuomo administration was publicly saying about those deaths, putting the count at about half that number. The administration's public count only included residents who died at long-term care facilities, not residents who got sick and later died at hospitals. Special counsel to Governor Cuomo saying the administration consistently followed federal guidelines, saying the out-of-facility data was omitted after DOH, the Department of Health, could not confirm it had been adequately verified. This did not change the conclusion of the report. Vivian Zayas is not buying the explanation about how the numbers were reported by the administration. Her mother was a resident at a nursing home who contracted COVID-19 and later died at a hospital.
We felt insulted all these months of hearing him talk about a book and going on The View and parading, different events, touting his success. And here we are, the family is holding on to what's left of the dry grass.